you are in your 40s or beyond and your hormones feel like they are throwing a full-blown party without your permission, you are not alone. Hot flashes, mood swings, random night sweats. 1 minute you are crying at a toothpaste and the next you are yelling at the fridge for being empty. Today we are talking HRT, that is hormone replacement therapy. The good, the bad, and the misunderstood. So grab a cup of tea or a bottle of water and let's dive in. If you are new, consider subscribing, turn on the post notification bell, and don't forget to like. Here's the deal. Once women hit their 40s, perimenopause starts creeping in. It's like menopause, younger, chaotic cousin. Hormones like estrogen, progesterone, and testosterone start dropping. Sometimes slowly, sometimes like a sudden stock market crash. What does that mean for you? Hot flashes, vaginal dryness, low libido, mood swings, brain fog, sleep issues, weight gain, anxiety, and depression. It's not in your head, it's not just aging, it's hormonal, and that's where HRT comes in. HRT stands for Hormone Replacement Therapy, a medical treatment that gives your body the estrogen, progesterone, and sometimes testosterone that it's no longer making on its own. There are two main types. The first one is systemic HRT. It goes through your bloodstream to treat all body symptoms, hot flashes, night sweat, and so on. And the pills, patches, gels, or sprays. The second one is local HRT. Stays in one area like the vagina to help with dryness or pain during sex. This is usually in the form of creams, tablets, or rings. So now let's talk about myths. Some said HRT causes breast cancer. The truth is, this is the biggest fear. Yes, some older studies like the 2002 Women Health Initiative raised concerns, but they use a synthetic hormone, not bioidentical ones. Modern research shows low dose HRT started before age 60 or within 10 years of menopause is safe for most women. The risk of breast cancer is very small and similar to lifestyle risk like drinking alcohol or being overweight. The second myth is that HRT is only for severe symptoms. The truth is, even mild symptoms can ruin your quality of life. You don't have to suffer just because you are not bedridden. If you are not sleeping, snapping at your kids, or feeling like a zombie at work, that is reason enough to explore your option. The 3 is natural is always better. The truth is that we love natural things too. Ginger tea, shea butter, all of that, but natural doesn't always mean better or safe. Some herbal remedies may not be effective, and not everything natural is regulated. The fourth myth is that you'll be on HRT forever. That's not true. Most women use HRT for 2 to 3 years, sometimes longer, depending on symptoms and doctor's advice. It's not a lifetime sentence, okay? First, bioidentical hormones. These are hormones that are chemically identical to the ones in your body, the one your body makes. The source is from plants like yam or soy. It is available in FDA approved forms, and the important thing to know is that it can be taken as a pill, patches, cream, or gels. It is often preferred because they feel like they feel more natural to the body. The second one is compounded HRT. This is custom made HRT mixed by a compounding pharmacy. It sounds fancy, but it's not FDA approved, and that can mean inconsistency in dose or safety. Only go this route if regular HRT doesn't work for you, and always with a trusted doctor. The third one is micronized progesterone. This is the progesterone that that's gentler on the body and brain. Women using this often report better sleep, and fewer mood issues. The first one is testosterone for women. Yes, women also need testosterone in small amounts. It can improve energy, libido, and motivation, but it's not widely available for women in some countries, and it should only be used under medical supervision. Now listen, HRT is not a one-size-fits-all. HRT might be a good fit if you have hot flashes, night sweats, or poor sleep. It might be a good fit if you feel depressed or anxious for no clear reason, okay? It can be a good reason if you have vaginal dryness or pain during sex, or if you are feeling like a shadow of yourself. It can be a good reason if you have entered menopause before age 45. HRT might not be for you if you have a history of breast or ovarian cancer, if you have had blood clots, stroke, or uncontrolled high blood pressure. It cannot be a good reason if you are not comfortable using hormones and want other options. There are non-hormonal treatments as well, like antidepressant, hormone and hot flashes, vaginal moisturizer, lifestyle changes, and natural supplements. Just make sure they are backed by science, okay? Here's a cheat sheet to take to your appointment. What kind of HRT is right for me? Systemic or local? Another one is, should I use biomedical hormones? Next is, what are the risks based on my family history and health? Another thing you can look at is, what side effects should I watch out for? Okay, how long should I stay on it? What are the non-hormonal options if I change my mind? Don't let a rushed appointment or fear keep you from acting everything on your heart. This is your health, your hormones, your life. Okay, here's the truth, sis. Menopause is not a death sentence. It's not the end of your femininity or your vibrancy. It's just another stage, but that doesn't mean you have to suffer through it. If HRT can help you sleep better, feel sexy again, stop crying for no reason, or just feel like yourself, then it is worth exploring. You are not being dramatic, you are not broken, you are just hormonal, and guess what? There is help. If you found this video helpful, hit that like button and subscribe for more real talk about women's health. Drop your question or experience in the comments. Let's make this a judgment-free zone where women support women. Until next time, stay balanced, stay beautiful, and take care of you. You can only do that for yourself. Bye.